everyone, and welcome back to my channel. Today I'm going to talk about the topic of induction, so induced birth, whether you are being induced because your baby is measuring a little bit big or small on scans, whether you have developed diabetes throughout your pregnancy, for whatever reason that it is, make sure that it's the reason that has your baby and your health at the heart of the induction. An induction is certainly not the recommended way for having a more gentle birth experience, because it can take a while for your body to catch up and release all of those lovely natural pain relievers, those endorphins that we talk about so much in hypnobirthing. But I'm going to give you my top 4 tips today to help you have the most positive, most gentle induction birth that you possibly can have. I hope you enjoy them, and if you are interested in more content relating to pregnancy, birth, postpartum and breastfeeding, please make sure and hit that subscribe button down below and hit that notification bell if you don't want to miss any more of my videos. So if this is the first time that you've come to my channel, my name is Kitty Hackle. I am a registered general nurse. I'm also a lactation consultant, a birth and postpartum doula. I teach antenatal classes and hypnobirthing classes, both online and in person. Go and check out my website that I'll have linked down below if you're interested in learning a little bit more and preparing you for a positive and gentle birth experience. So let's dive right into the topic of induction, particularly around this time of year. We're coming up to sort of lots of holiday time, and I often see where many of my clients end up having the discussions with their care providers regarding inducing their labours for maybe the wrong reasons. So my first tip is to have a really wonderful open communication with your care provider. That means knowing how to ask the right questions. That means if you forget all of the communication tools that you've learned in your antenatal classes and remember only one thing, come back to, is mum okay and is my baby okay? If those two things are perfectly fine and you're both plodding along quite healthily, chances are the induction isn't maybe for the right reason. It might be because your care provider wants to go on holidays and they want to be at home with their family. And personally, I would say that's quite open for discussion. I would say that this is the only time that you are going to give birth to this baby, and that this day is really important for you. So it's worthwhile having those discussions, finding out where your heart sits in terms of what sort of birth is right for you. If you are hoping for a positive birth experience where you are feeling empowered, an induction is absolutely possible, but it's much more difficult to get things moving, seeing as most of the time there's a reason that your baby hasn't come themselves at this point. It is much easier for you to have a natural progression of labour if the onset of labour is something that has started naturally. Generally speaking, there's a sort of cascade of hormones, a sort of cocktail of hormones that is released, whereby your baby, your placenta and your body let you know that they are ready for birth to begin. So having the conversation, making sure that it's something that you and your birth partner are really comfortable with and really happy with the decision is key, because you have to be feeling good, you have to be feeling ready, you have to be feeling prepped for the induction process before it begins. So my tip number 1 is to rest. With an induction of labour process, things can take a little bit longer to get started. It can take a little bit of a longer period of time for your body to sort of get the message to sort of continue the birthing process. Quite often it can involve sort of several interventions by your care provider to give your body the sort of nudge to get into labour. So resting as much as possible in those early phases, using your distraction techniques, resting in the bed as much as you can, getting yourself comfortable and being sort of kitted out for a long ride. You want to make sure that the first day sort of melts away. It can be quite a long process, and the last thing that you want to be doing is feeling like it's just been a sort of long and never-ending process. You want to be able to feel excited and resting in those first early phases while your body is sort of taking its time to get the message that labour is going to begin, can be a really good idea. So my next tip then is to start your comfort measures nice and early. There's 2 reasons that I really think this is a good idea. The first one is that it's no time to be trying to figure out what you want to do and what works and what doesn't work when you are in the throes of an intense surge. You want to be starting when those surges begin, when they are starting off with little niggles, so that you and your birth partner can work together to figure out what works for you. The second reason for that is that you want your endorphin levels, so your natural pain relievers, to be at an all-time high. So if you're using comfort measures like the TENS machine, you might actually find it beneficial to apply the pads and begin using the TENS machine from about an hour before your induction process begins. That way your natural pain relievers, so your endorphins, are already at an all-time high, which means that they can work really nicely to sort of continue along that really comfortable birthing process. So my next tip then is, I bet any of you could guess it. It's about coming back to your oxytocin. You want to be thinking romance, and I'm always talking about this in my hypnobirthing classes. This is going to be the most important date of your life. So you want to think dimming the lights, getting your fairy lights out, your LED candles out. You want to be using the comfort measures with your scent, so your aromatherapy oils, if that's what you're thinking about using. You want to be thinking about using massage, all of these other lovely things, these other comfort measures that you might have already learned about from previous videos of mine, or if you've taken a class already. You want to be creating the idea of romance in that delivery room, whether it is a hospital bed or whether you are in a small antenatal space in one of the wards. You can absolutely create that space of serenity. Pop up your little affirmation cards, put your string of fairy lights along the back of your bed, put on a face mask if you just don't, an eye mask if you just don't want to see it at all. Coming back to the space where that oxytocin is at an all-time high means that you're more likely to have that sort of continuous progression of labour and less likely to end up with other interventions along the road. So the next tip that I have is going to be about using your natural labour enhancers. So those are things that, had you been trying to get labour moving along yourself, don't give up on those now. Try and use those as a part of your labour to get things moving. I actually have an entire video on natural induction methods that I'll leave linked down below here, and that goes through a couple more ideas. But the sort of things that we're thinking about here to help things move along and lessen the likelihood of having medical intervention would be using gravity in your favour. The more you are upright, the more space there is in your pelvis for baby's head to move down, and the more likelihood that your baby's head is going to be placed directly on your cervix. And the more that your baby's head is on the cervix, the more prostaglandin is released that softens and readies your cervix for that process of opening up and dilating for birth, and bringing that lovely feedback of endorphins to your brain. You also want to be doing things like kissing and cuddling, so keeping your oxytocin high, nipple stimulation, so you might bring your pump with you. It's a good time to try it out. Things like this can really encourage the birthing process to move along as it would naturally. There's no reason for you to be just going down a medical route. You can have a beautiful combination of the both. So I really hope that you found that video helpful and it gave you a few ideas in terms of things that you can do to help you with the induction process be a positive and empowering experience for you. I will leave down below that video that I was talking about regarding natural induction methods, and I will also leave down below some articles that I found really helpful and really well referenced around the topic of induction of birth.